Hello again, and we're back with news from the Democratic Republic of Congo, where nearly 50 Ebola cases have been confirmed. Last month, the World Health Organization expressed concern over the outbreak in the country's west. We're joined by the World Health Organization's Regional Officer for Africa, Dr. Michel Yao. Thank you very much for your time this afternoon. Just how active is the outbreak in the region?
Thank you very much. The situation is evolving and is of concern. We move from 3 districts that they call them zone de santé to now 6 districts. As of 13, the data report by the government, they are reporting 52 cases with 21 deaths. So this is what we are experiencing now in the western part, Equator province in DRC.
If you could give us an idea of geographically, what is the space like? We keep referring to the western part of the DRC. For those of us who have not been fortunate enough to visit, just how vast is that space?
It's quite bigger than some of the smaller countries in Africa, some of the cases were distance from one to each other of 250 kilometers. So it's a huge area. And the critical thing is that when you move in the northern part, you have Central African Republic, and it's also have the river. Where you go down to the river, you can also reach Congo-Brazzaville. So there are 2 countries, neighboring countries, that could be easily affected due to trade that is occurring between countries.
What work is being done to arrest the situation and decrease the spread or the contamination of the virus?
We are providing the usual support, but as it's the second time that we are experiencing this outbreak there, we are also relying on local capacity. Unfortunately, with the situation evolving, we have to surge more, and we are doing it with different partners, UN agencies as well as NGOs. Some of them have taken over already treatment center there. We also ensure that we use some of the innovation, like the vaccination. We have vaccinated close to 12,000 people already. So we are also supporting, of course, the surveillance, the data analysis, and also investigation with an alert system that can help us to speed up in terms of detection. Because time being, we detect sometimes the cases late where they turn into community death, what is not good because people have time to contaminate their relatives before dying.
Add to this very complicated situation, you've got COVID-19, you've also got conflict in some parts of the area. In terms of sentiment on the ground, are you aware how people are feeling?
On the ground, people are a bit disturbed because while dealing with COVID, with all the preventive measures, then you have also to add Ebola on. So it could bring quickly mainly for around people that are not educated, the problem of confusion of what is it about. And so it requires also involvement of communities and also strengthening what we call risk communication and community engagement activities, what we are doing with partners like UNICEF and some NGOs on the ground. So more communication, at least to help people to understand and to take the appropriate preventive measures.
Are people understanding, much like the coronavirus, this is very much dependent on human behavior? You mentioned a little bit earlier on that the transmission is from human to human. So would you say that the message is seeping in?
This message is, yes, is going through, but as in many African countries, of course, you have people that deny the existence of this disease. So it's a continuous work, and it's also using some local channel with a local language using also local leaders, and this is what we are emphasizing on. The other challenge is also availability of what is required to apply the preventive measure. In some of the places, it's about availability of even water and soap or sanitizers, and also availability of masks and protective equipment. In these areas, due to recurrent crises, the health system could not work to be resilient. So it is a fragile health system that we need also to support if you want them to kind of set up an appropriate response to COVID. So it's a big challenge, and it's a place that requires a huge support now that they have a double burden related to COVID and Ebola.
Dr. Michel Yao is from the World Health Organization, and he's the regional officer for Africa out in the Democratic Republic of Congo for us. Thank you very much for your time.